So think left side, think pulmonary. Right side of the heart failure, you're going to see more venous type problems, okay? So there you are going to see where you're not having to return to the heart that we need to, okay? Left side, and remember, once it reaches the left side of the heart, it goes off and into the lungs and becomes oxygenated, okay? We don't have that because there's some fault in that left side of the heart, so we don't get the oxygenation, okay? So we start seeing more pulmonary problems, okay? Right side again, look for more venous because we don't have the venous return, all right? So it's not coming back, the blood's not coming back to the heart like it needs to and goes back through the system, okay? So, shortness of breath, O2 sats, you can look at some ABG problems with left side. Those are going to be the ones that you hear coughing and hacking, okay? Because they've got build up there, we're just not pushing the blood through the heart like we're supposed to. Okay?
Would that be like the bronchitis and that emphysema? That's right.
That's all lungs. That's not heart itself.
So congestive heart
Okay?
failure.
Now one can cause the other, but right now we're just talking heart failure. Okay? Because it is the left side of the heart that shoots the blood into the lungs. I mean, that's where we go with that. That's why we start seeing pulmonary problems and back up into the pulmonary system many times if the blood is not being able to be pumped back out and into circulation. Because remember, it goes through the lungs and then it gets pumped back out into the circulation, and that's how we get oxygen to the rest of the body, right? So don't think lung problems at this point. We're talking heart, but because of the oxygenation, that's what's going to happen. We're going to start having some backup into the lungs.
Our signs and
Okay?
symptoms will show in.
Your signs and symptoms are going to look more pulmonary. Okay? And then right-sided again is more venous. Left-sided, which do you think is really more common? It seems like left-sided should be more common. Many times you can have both. What happens a lot of times is the left side backs up and then it backs up into the right side, so then you've got both. Then you're going to see a lot of the edema, you're going to have a lot of the bluish discoloration, the cool extremities, okay, because you actually have heart failure on both sides of the heart. All right? Left side, yes, is going to be more common of the two. Okay? So right-sided heart failure, if you've got the blood that's going down, but we're not pumping back up, so what are you looking at then?
Edema?
You're going to look at more of the edema at that point. Okay? So pulses are going to be harder to find because of the edema. Okay? Think again, when you're thinking of right and left, think oxygenation left, not so much right. Okay? But so the right side you're going to have edema, whereas if you've got problems with the left side of your heart, you're going to have more of the discoloration, the coolness, okay, because you don't have that oxygenation going to the body like it needs to. Does that make sense?
Yeah.
Right-sided, like I say, you might have edema. Feet still might be warm and pink, but they're going to be swollen, and you're not getting it back up. So what are we going to do for each of those? If it's left-sided heart failure, what do you think we need to do to take care of those patients?
Tight hose.
You take
Oxygen? Diuretics?
Yes, they take the fluids off.
We need to get rid of some of that extra fluid. Okay? So if it's right-sided, what do we do for right-sided?
Tight hose.
Ted hose?
Lasix.
Lasix probably too. Again, a lot of times you're going to see a combination of the two. So, okay? Yep, Lasix or diuretic. Elevate
Yeah.
or down?
Elevate.
Think right and left a little bit again. Did you guys talk about venous versus arterial? And if you've got an arterial, have you hit that part yet?
No.
No. Venous circulation versus arterial circulation. If you've got arterial problems, again, you're kind of talking more left side because you don't have the oxygenation. Okay? Venous, you've got right-sided. Okay? More right side. So you have to think about what we want to do. Again, if you think, without the oxygen, we're going to be cool. We're going to have a bluish discoloration. Okay? So what do we want to do for that in comparison? Sometimes to keep the legs dependent, if it's more an arterial problem. With a venous problem, we've got to get that blood kicked back up to the heart, so then we're going to elevate. Okay? So, like I said, I'm not sure where Shelley has gotten in this whole process, but she should be talking about arterial